The death now of medical intern Dr Alulutho Mazwi at the Prince Mshiyeni Memorial Hospital is raising serious concerns about the treatment of junior doctors. Despite being seriously ill, he was reportedly forced to go to work. The South African Medical Association trade union is calling for a full investigation, and they say there have been inhumane working conditions in that environment. And so we talk now to SAMATU's General Secretary, Dr Cedric Sihlangu, to talk about what happened and also what needs to change. Dr Sihlangu, thank you for your time and of course, condolences to all of you and to the medical fraternity who are mourning the passing of the doctor. Dr Mazwi's death has sparked national outrage. Let's start with the specific information that you as SAMATU have been able to gather so far about the circumstances that led to his death.
Morning, Iman, and thank you for having us. I think firstly, we are deeply saddened really by the loss of a colleague, and also sincere condolences to the family, and we wish them strength during this very difficult time. Now, we as SAMATU have been raising concerns in how interns are treated throughout the country, in how interns are subjected to very harsh working conditions. Interns are made to work long hours, often uncompensated. So you find interns working way beyond their prescribed overtime and without any compensation at all. So when we heard the very sad news in Prince Mshiyeni, we really felt the pain, because this is something we've been talking about for quite some time. We've called on for a thorough investigation into the situation in Prince Mshiyeni so that objective facts could be ascertained in terms of what transpired in that particular situation. We don't want to jump the gun, as it were, but we do need this matter to be thoroughly investigated.
So you have described the treatment of Dr Mazwi as inhumane. Can you elaborate on the kind of working conditions and also systemic pressures that junior doctors, particularly interns, face in public hospitals like Prince Mshiyeni Memorial?
Yeah, certainly. I think our approach has been very clear, and as I've indicated, that this is not a Prince Mshiyeni matter; it's a national phenomenon where interns, because they have to go through rotations, and those rotations, they require to be signed off so that they can go to the next rotation, so they can complete their training. What often happens is their supervisors, their senior colleagues and their consultants often subject them to treatment as though they are less than. And what we mean by that is they are often made, humiliated during ward rounds. They are made to work beyond what would be a reasonable working hours. And of course, as a union, we've been very, the employment conditions of employees. And need a medical intern to come to work at 6 o'clock in the morning when they only start getting paid at 7:30 or 8, and to expect them to work until 7 p.m. when their contract says they'll work until 4:30 or 5. That in itself demonstrates that the employers believe they've got power over these interns. And because the interns need to be signed off to progress and complete their training, they are almost, helpless. And that's precisely what happens time and again. And more often, when interns are made to cover their night shift, their overtime, they would work from evening until the next morning and continue to work until 4 o'clock. So you find junior doctors working beyond 30 hours. And by the time they're actually treating patients, they're as good as zombified. They're not actually functioning optimally. And we've seen that results in a lot of mistakes. It also means that when they drive home after a long 30-hour shift, they actually get involved in car accidents because of the nature of the exposure that they get exposed to in terms of how they work and their working environment.
Cedric, what you're describing is, it's just inhumane. Besides being inhumane, it's just fundamentally unjust. How is it that it's become the norm in a sense? We've spoken to doctors over time. This has been the perennial complaint. Why does it still exist like this?
Yeah, you see, the problem really stems from, in our view, the culture that has been entrenched in the practice of medicine, that you should be self-sacrificing, that you come last, your own mental health come last, and your own well-being comes last. You must put yourself first, to your own detriment at times. And if you don't do that, your own senior colleagues see you as there's something wrong with you. When you want to, fight for your own rights so that you are treated, in a manner that is fair, you are seen as an outlier. And in more instances, you then get, marginalized. You get, in a way, the system will deal with you. And that's the unfortunate reality, that these junior doctors become so fearful in expressing themselves, in saying, I'm tired, in saying, I'm not coping, that if you do that, then you're not going to complete your training block. We're going to keep you behind until you bow down to the so-called authorities. And that's something that SAMATU has been very vocal about. And we're actually going to start a process now, Iman, of doing audits of the calls that these junior doctors are being subjected to. We are going to do a nationwide program where we go through the full rosters and see that in this month, how many hours did this doctor work? How many hours did that doctor work? Because we know these doctors are doing over 100 hours of overtime where they're only compensated at 60 or 70 hours. So you find an excess of 30 hours where this person is simply expected to work without any compensation.
It makes you wonder why the heck, why you would want to become a doctor in South Africa, because if this is the journey to that and there's so much exploitation and abuse such as you are describing, it certainly would be, a prohibitive factor. Now, Cedric, just to close off, some are calling for criminal and professional misconduct charges against the senior staff allegedly involved. Would SAMATU support something like this, and what kind of precedent do you believe needs to be set to prevent future tragedies if all of the facts stack up in the way that you've described?
Look, SAMATU as an organization believes in the rules that are enshrined in our procedural processes, the labor processes. So we believe in the principles of ODL Param Partum, to hear the other side. We believe in processes that are fair. So we are calling for a thorough, clear, fair investigation, that upon those outcomes, and not to preempt the outcomes, then decisive action ought to be taken once an investigation has been concluded. So we definitely would call for a fair, clear process that will lead us to some form of justice if indeed there are issues of inappropriate, unprofessional conduct and what have you.